Hey,
Hi.
what is going on?
When this happens, I blame it on Mercury in retrograde. I know that it went out of retrograde yesterday, but apparently there's still like a shadow period afterwards. So I'm just going to blame it
Okay.
on that. But anyway, yeah, thank you. You did a little bit of an introduction, but let's talk about, I mean, if you don't mind sharing a little bit about like what your journey has been like. What I think it's helpful for people to really hear people who are struggling and to hear inspiring stories to help them on their process. So, do you mind sharing a little bit?
Oh, not at all.
Okay.
I love talking about it actually. Once you get a little bit of distance from it, especially, it just, I don't know, it's not as emotionally charged as it used to be. But yeah, so basically, like I said, I was a an opiate addict and a benzo addict. And so that started off after a back injury. But I'll go back a little bit further and just say, I grew up in a very eclectic community here in Austin, Texas. My grandmother was a hippie from San Francisco. My dad is a musician. My uncle as well, and they're just huge staples in the Austin music scene. And so I grew up in and around that culture. And so it was a gift. Like it was cool because I grew up around a lot of different people, a lot of different energies, but then a lot of like alcoholism and addiction as well. And so I was kind of indoctrinated into that way of thinking at a young age. And then basically I kind of fought that for a while because it was so prevalent in my life. I was like hesitant to drink or hesitant to try cannabis and stuff like that because, it was just so you kind of get like when you see that and like your elders are doing it, then it makes you kind of like, oh, I don't know. And so, yeah, that's basically my childhood was just live music, creativity, just really awesome stuff like that. But then, like I said, there was the other side that was a little bit darker. And basically, I'm not gonna blame, my accident where I got hit by a car on my addiction, but that's what like inflamed the dormant like mental health stuff and addiction stuff is basically I was hit by a car on my bike and they administered pain meds and it was like an instantaneous kind of thing to where I was like, oh wow, okay, maybe this is how a normal person feels or how I can get through life. And that's a huge red flag if you're administered opiates. And the first thing you start thinking is, oh, I think I need to do this for the rest of my life,
Right.
basically.
What year was this that this happened?
This was, I want to say, 2010, 2010, I want to say.
Hmm.
And so, I'm a teenager and it's just like, it's so they administered it like intravenously and I remember that was the first time that I had experienced that and so that I think is why it was so like such an instantaneous kind of thing and I remember smiling. I was on the ground, because they shut down the street that I got hit on and I was smiling and my family, they called my family and they're like standing on the side of the road screaming and crying and I'm like, I'm good, it's okay. So it
Jeez.
was yeah, it was rough. And so they basically they gave me like a take home for I think it was just like 10 milligram Norco, like Vicodin, and then they gave me 10 milligram Valium. So that's what really did it for me is the combo. And that's why I'm so passionate about, recovery from opiates and benzos, because it was just so strong. It was so strong. And I didn't abuse it at first. It took me probably about 6 months to think, hey, maybe I should like try a little bit more. But it inflamed dormant addiction. Like it was just like it came to the surface and my way of thinking changed. I became a little bit more pessimistic, cynical, and as someone who's super sensitive and nice and stuff, it like took away a lot of my really good traits, and I could feel that happening. And so, yeah, I was addicted to opiates and benzos for almost 7 years, and I doctor shopped. I went to doctors, and was intentionally trying to get opiates and benzos, and this creates this weird lacking mentality where you're never feeling like you have enough, and it's just a perpetual search. And it was like that for years, and that's like what I did. And I want to say that for me, opiates made my chronic pain worse because I had legitimate chronic pain, and it just kind of it perpetuated it. And I had a preoccupation with the pain. I was obsessed with the pain, and that seemed to put my focus into it. And then that created more of it. And then you could go into saying, that supposedly you get more pain receptors when you take opiates long term. And so I experienced that as well. But basically that came to a head after, almost 7 years. I ended up getting on methadone because it was accessible and I didn't have to doctor shop all the time. And so I went into that. My intentions weren't really good though, to be completely honest, is my impulse control wasn't there. My morals and stuff were kind of just not there either. And so I went into it trying to get a high out of it, but also it was this weird thing to where I had legitimate chronic pain. But basically that's what brought me to the point to where I was like, I don't think I'm going to survive this, basically. And I had symptoms of respiratory failure because I was on, at that point, Klonopin with the methadone. And it brought me down to my knees. And luckily I had people intervene because at that point, didn't have any willingness and I didn't think I could survive. I thought I was done. So super grateful to have had an intervention, woke up to people intervening, and got sent to Mississippi in the same day. So, I took a plane to Mississippi from Austin, which is a culture shock completely. Wasn't somewhere that I ever planned on going, but it ultimately did save my life. And I met people there, peers that told me about recovery. I had a counselor named Lisa who changed the way I viewed everything, basically, because she had lived experience. And so that's why I do this today, is because she made all the difference, because she went from a perspective that was not necessarily clinical, but just completely direct, this is how it is. You're killing yourself. You need to stop doing this because you're throwing yourself a pity party while also killing yourself. So you need to make some changes. And that's what it took for me. And so that's why I'm so into this advocacy and this lived experience stuff, because it saved my life. It really, it did. And I was able to take the actions to grow and to learn some new disciplines. And so, yeah, I'm really grateful for the opportunity to do this, because it's part of my purpose. And so anytime I can talk about it, I will take that opportunity.
Well, and it's really clear because I can see in your content, you are committed and you're giving back to your community and you are helping others along the way. I mean, and I see the comments too. I can tell you are helping other people. So I know that's a really important part of the recovery process. And I want to validate, both benzos and opiates, on their own, highly addictive, and then the combination even more so. And so, how long did it take you to feel, well, actually, let me ask you a couple things. When you went to the center in Mississippi, did you have to go through a detox process, or what did they do there? Okay, so you did do a detox there.
Yeah. So basically, my mom was talking to an addictionologist, really awesome person. I ended up working with him later on when I got out of treatment. But anyways, just to give you a little bit of backstory, my mom was dating someone at the time who was wealthy. And so that's the only reason I was able to go to this treatment center, because it was very, very expensive. And so that's a whole nother subject, accessibility of treatment and all that. I'm very passionate about that as well. But basically, I was on 160 milligrams of methadone, which is a very, very high dose. And then I was taking upwards of 9 to 10 milligrams of Klonopin a day. And so a lot of treatment centers wouldn't take me because of that. And it was a risk. And so we found one, it was called Copac in Mississippi, that took in doctors and just professionals in that field, even just the medical field in general. Yeah. And I don't know why they were more equipped, but they were. And they put me on a phenobarbital, the barbiturate, and then they did a slow taper on the methadone, and they switched me to Suboxone for about 3 weeks. And I'm really grateful that I was in treatment during that, because it kept me from doing it. I kind of went into a psychosis, to be quite honest. And they ended up, administering antipsychotics, specifically Haldol, which is very, very strong. And that it put me in a place to where I wasn't trying to run away anymore because I was like plotting on how I could run away from here. And like,
Well, no
I was,
doubt.
yeah, I was like romanticizing like floating down the Mississippi River and like getting away. But anyways, that was a pivotal part of my recovery. And that's why I always am very, very careful when I talk about this stuff, because people DM me all the time asking like, how do I do this at home? And I
Oh,
can't, I literally just say, I'm sorry, I cannot advise you. Like, I can't give you any medical advice. Like, I take it super serious. I'm like, I can't tell you that. I'm sorry. Like, I don't even know. But I think medical detox is the safest way to do it, especially with benzos, because you can, have
I
seizures
agree.
and complications. So yeah, it's a part of, I'm very passionate about advocating for medical detox because it's part of why I'm here, part of why I survived.
Yeah, I agree. And it's so good to have that medical monitoring and the intervention. And it can go bad really quickly for people. I mean, and to pull in other substances too. I mean, for sure, alcohol. Often people minimize what is required for an alcohol detox, and that's life-threatening also. So anyway, yeah, if hopefully people can explore their options for that and then find detox facilities where they're going to get the right kind of treatment. So going through that, like at what point did you feel like, okay, I mean, you feel so crappy when you're going through that process. Was there a point when you're like, okay, I feel all right? Because that is so prolonged. And I think a big part of recovery, at least early recovery, is reassuring people that it takes time. Like they're going
Yes.
to feel like crap and it's going to take time for them to feel better. So how long was that for you? Not that that is how it's going to be for other people, but I'm just
Yeah.
curious your experience.
Well, to be completely honest, I want to say minimum about 6 months.
Yeah,
And I was in treatment for 3. So, and I did about six months in a sober living house.
right.
And I always say this, I started to feel better when I started to really work on the underlying issues. You know what I mean? There was a direct correlation there. And specifically addressing my fears was a huge one. And really just learning some coping skills. I didn't have any coping skills, to be completely honest. And so
Yeah.
it was like just learning to do a little morning routine or just talking about how I felt. I was so removed from that. And realizing that I could do that was huge. And that's directly related to me feeling better. Like I started to feel better when I was doing that stuff. And so I always encourage people, like, talk about it, do anything you can, take any positive resource that you can and utilize that, because that's what's going to make a difference. There's a huge difference between just not using drugs and actively working in recovery. And you know, uh, I get redundant because I say that over and over again, but it's so important. It's so important.
I
I
think people
always,
need to hear those things again and again too. Yeah.
I always say it's just like I was at first, before I was doing anything, I was worse off than I was on the substances, to be completely real, because I didn't have my so-called medicine. And so a lot of people say that too. It's like a marker for someone who's a real addict or an alcoholic. You can really look at that and see like, oh, is it getting more emotionally charged? Are you having rebound depression, anxiety, and all that? And I took that as motivation to work on myself. And to be quite honest, I was tired. I was so tired of the old way of life, but I had never been presented with a solution. I didn't see a solution. And so when I saw one, I was like, you know what? I'll try this. And at first it was more like, I'm going to prove this doesn't work, to be completely honest. I was like, I'll do all this recovery stuff and it's not going to work, but it did. I'm still here today. And so,
That's great. And I think that's an important part too, because it's not like you have to have total buy-in in the beginning. And I don't think most people do, because they don't know anything else. And for somebody like yourself who came into this as an adolescent, like you don't have the tools, you don't have the sense of self-worth because you didn't have the chance to really develop those. So there's a lot of catch-up happening during this period too.
yes, yes. No, I definitely relate to that. It's interesting. A lot of people have this, there's the saying that you stop maturing when you start using, and for me, it's very true. And so I had to do a lot of growth in my early 20s that I should have done in my later teen years. And it just, it was very interesting to say the least. But I can say now, looking back on it, I don't feel behind like I used to. And that's something that I like to talk about with people is like, don't focus on how old you are. Don't focus on, if you feel you're too old for recovery, it's too late, or you're too young. No, like if it's time, it's time. And you can gain willingness later. Like I firmly believe that because I went into treatment unwilling. Like I was codependent and I was given ultimatums, so it was like, I'll
Which
go to treatment
is typical
because of that.
Like that's so yeah, and that's so typical for people. And so for those who maybe have a loved one who's very resistant, I think that's an important message too, is to cat.
I love it.
Is to is to like to continue to point them in that direction and then help them get the help that they need, even if that resistance is still there. Because most people go to treatment like without a total commitment, and they're not entirely ready. I mean, there are those who are, but I think the majority, in my experience, are not. And actually, a lot of the time, it is an intervention, and there are strings attached to it, and that's okay.
Yeah, no, totally. I think the idea that a lot of people perpetuate in some recovery programs, the idea basically that if you're not willing, you're not ready, you need to go back out there and have more experiences. And honestly, if someone is at risk of dying, then no, I think you can intervene and you can even get court orders. There's all that kind of stuff. And sometimes that's necessary to save someone's life. And so I'm honestly strongly against that narrative because I think it's just insensitive and it's kind of dogma. You know what I mean? I don't subscribe to that. And you could say because maybe I'm biased because that was my experience, that I wasn't willing and I gained it later. But I don't think I'm special. You know what I mean? I think anyone can gain the willingness.
I agree. And I think there's more buy-in as people are surrounded by folks in recovery. And then also as they see the benefits of that too. Even though in the beginning, it's hard to really like see that because you're feeling so crappy. So another thing I'm really interested in asking you about is being a vegan chef. I mean, I imagine that's a big part of your recovery. I'm a big advocate, and a lot of what I do is really helping people feel their best so that they want to be in recovery and they want to move forward and away from being in that place of suffering. So what role does, like diet and lifestyle, what role does that play for you?
I love your questions. All the stuff that I love to talk about. Thank you. It's a little I feel a little bit self-indulgent here, but honestly, so I was just a normal professional chef. That lifestyle was not working for me. It made me angry. I was just I would go, be at home with my hands clenched. Like it was that bad.
Well, and what I hear from people who've worked in that environment, there's a lot of drugs and alcohol.
Oh yeah. Yeah.
So I think that's a really hard place to be.
Definitely. I worked for a company that was focused on employing people in recovery. So it was,
right.
So that's the only reason why I really got into it. After, I trained for years as a young person and, worked in catering and stuff like that. But I'd never really, gotten into that fully until I was in recovery. And basically, someone that I met in treatment started a company, and it was just purely people in recovery. But a lot of stuff came up with that still was frustrating. I'll just say that. And basically, for me, it just, like I said, it still made me my energy was off. I was so hyper focused on the quality in which I would plate things and just preoccupied with stuff that was kind of inflaming my ego, to be quite honest. And it just turned me into a jerk. I was a jerk, and I can acknowledge that because I worked on that and I got over those behaviors. But basically it was about, I want to say when I hit about 4 years, my recovery changed drastically. I went to this thing called the Landmark Forum. I don't know if you ever heard of it. I'm not a huge advocate for that. It did change my life. It's like a self-help thing that a lot of professionals do. Someone at the time paid for it for me and was like, hey, just go to this. And so I did. And I'm not really going to go into detail with that, but it is a cool thing, and it definitely changed my life. But it made me realize that my words and my actions weren't in alignment. That I was saying, for one, I'm saying, oh, I'm an animal lover and I'm eating animals. And I'm saying like all this, just a lot of stuff. I gained a lot of awareness about the walk and the talk just not being there. And authenticity is another thing. I thought I was so authentic, and I realized that there were some discrepancies. And so that is when it was December 21st of, I want to say 2018. And in an instant, I made a decision. I'm about to change all these discrepancies. And so I went and returned all my animal products that I had in my refrigerator to HEB. They took the returns, which was interesting. Wouldn't expect that. But anyways, I made the decision really quickly because I was in recovery and I was so focused on these disciplines, but I wasn't being compassionate towards my body, myself. And so, yeah, I was being too hard on myself, and it was making me into a jerk. And it made me angry. I had to add like a little bit of an anger thing coming up, which is just not something that is really like me at all. And so to me, that was a huge marker to change. And it sucks that I'm that type of person, but I usually have to run something into the ground before I do anything about it. I changed that now. I'm not like that anymore, but that was just that was how I was. And so basically I realized, hold on, I need to change my diet like right now. And I was eating greens like my life depended on it. It was like this weird, man, I can't even explain it. Like it was like a life or death thing in my head. I was like, I need to start, because I ate exclusively like meat. Like I was a meat and potatoes type of dude. And
good Texan.
yeah, a lot of barbecue. I grew up in and around barbecue. That was like a huge part of the culture. And so, yeah, so basically I realized, hey, this isn't in alignment with my ideas and my morals. And another thing is that I started doing research on your gut health, and specifically how dairy affects your brain, because it has opiate peptides in it. And so I was like, maybe there's a reason why I love drinking huge glasses of milk and eating cheese and stuff. And so I was like, what will happen if I cut all that stuff out of my life? At first, I felt pretty bad, honestly, because it was like I was going through a withdrawal, to be quite honest, specifically from the massive amounts of dairy and cheese. And then I started realizing, wait, I feel specifically my intuition was getting stronger. And this is kind of esoteric, this is kind of trippy here, but I noticed a direct correlation between not consuming animal products and my intuition. It was like, it felt just overwhelmingly strong at first, and then it kind of got a little balanced. And so for me now, I can say it's a huge part of my recovery in general, is like just being mindful of what I'm consuming. And I gained weight in a good way. I was always underweight. I was diagnosed with an eating disorder even in treatment. And so for once I was finally eating at least 3 meals a day, sometimes maybe just 2 large meals. I also started drinking water during this time. I did not drink water. I drank soda exclusively. And all of this happened at the same time. I also started supplementing with B12, zinc, D3, just a lot of the basic supplements that you take if you're on a vegan diet. And yeah, I just noticed that I felt better. Like I said, my intuition was stronger. And I went from being like pretty much emaciated as far as my weight to gaining healthy weight, and then also started exercising. So it was all 4 years into recovery. And so, yeah, it wasn't like I just was gung ho, like, oh yeah, now I'm going to eat healthy and not do drugs. And like, it was a slow process for me, but.
So at your center that you went through in the sober living, was that a component of their programs at all?
What, diet and stuff?
Yeah, diet and exercise. No, not really. That's unfortunate. Yeah.
Yeah, it was, look, like it did what it needed to do. The place I was at was very sketchy, to be completely honest. Like like I said, it helped me out. I made it through it, but there was a lot of stuff going on, and then it ended up getting shut down. So it doesn't exist anymore. It was really the people that had experience in recovery that helped me, as well as some clinical people. And it's just I'm a huge, like I said before, huge lived experience guy. But the sober living was just they only focused on if you were going to meetings and if you were doing your chores, basically, and if you were leaving. I think by like you had to leave by like 8 in the morning and not be just sitting there. So, but
Which
yeah,
is
it's
good too. I
unfortunate.
mean, they kept you sober, and the longer you can extend that and have that kind of structure, that's going to help with your brain and your physiology readjust too, which is really important. I mean, for any kind of recovery, and especially I think for like benzos and for opiate recovery, it's well, I think like the health component to really improve your vitality, your vital force, and that's more of a naturopathic term, but to pull those pieces in because that is so suppressed when you're in the addiction. Uh, does that make sense? As far as like really,
Yes.
it just seems like it's really especially profound in people using those substances, and it takes a while to really like rev that back up because it really, I mean, it suppresses brain function, but also like just overall vitality and energy.
Yes. Yeah. I had a lot of fatigue for a long
Mm,
time, just feeling perpetually tired, feeling like I could just sleep forever. And a lot of the meds I was taking contributed to that. And that's something that
sure.
I haven't really touched on. But they put me on a whole lot of, non-addictive medications. And I took those for about 3 years. And then I actually ended up taking medical CBD to get off that stuff. And I did that for about, I think, a year and a half or 2 years. And then I cut out everything. But around that same time, or at 4 years is when I got rid of nicotine and caffeine,
Oh, great.
and and that's when that change started to happen. Honestly is like for me, I had to just cut everything out. I still consume sugar, so people always poke at me for that. Like you still consume sugar. I'm like, dude, I honestly, my sugar intake is nothing at this point. But what you said, and I think is really interesting to look at, is that the benzos specifically, it took away my ability to think rationally or to prioritize anything in my life that was important. And it also, my brain was just overridden, and my motivation to do basic needs like eating and sleeping was just gone. And so in recovery, at first it was almost like a binge type thing with sleeping and eating, to where I was like
Yeah.
ravenous to consume stuff. Whereas at the first, maybe the first couple weeks, I still was very just nauseous and stuff because of the methadone withdrawal. But yeah, it's interesting how for me it robbed me of my humanity, to be completely honest. Is
Mm.
specifically that just that combo is so strong, and even like you said earlier, on their own they're just so addictive. And my thing is, I honestly, and I want to hear your opinion on this. I don't think that taking either of those medications long term is good or effective. And that's just I have a notable bias because of my experience with all of this stuff, but I've been looking into it a lot the past couple of years, and it's just I didn't know that people are having issues with benzos when they hit 2 to 4 weeks, and when they're taking them as prescribed. I didn't know that. And then there's a lot of stuff about the opiates, but I wanted to ask you your opinion, and what do you like? What do you think? Do you think that they have their place long term ever? And I'm baiting you here, kind of,
No,
but
well, and I'm trying to think of examples of where that might be indicated. And yeah, I think there would be. So we always think about like, well, I as a medical provider, I mean, you think of scenarios where maybe somebody is like going through cancer treatments or that kind of thing. I mean,
yes,
that's a really good indication for
yes,
those.
yes,
Uh,
I agree.
there's more of those are the exception than the rule, and there's starting to be a lot more education for medical providers about more cautious prescribing. And I saw what you posted about the pain scale recently, and I remember learning that. I went through naturopathic medical school in the late 90s and graduated in 2001. So that was like peak era for that because I remember being taught that was the fifth vital sign and how important that was. And that was like, ooh, that's new. We've got to pay attention to that. And uh, I'm just, I've been around long enough to see the transition between like not having any awareness about how important it is to prescribe those in a real mindful way and non-destructive way, really, and to see the transition now in the last few years about medical providers being required to have education about prescribing those medications. I mean, part of my licensure in Arizona is I have to have a few hours of opiate education every year
Oh, wow.
because it is such a priority. So, uh, yeah, I guess that's the answer to the question is usually no. It's certainly been overprescribed, and there will be some exceptions though where people do require that, but those are few and far between. Yeah.
Yeah, I agree. I'm sorry. I just I didn't mean to kind of bait you
Oh,
there.
no, you
Uh,
didn't.
the thing is I agree 100%. I think that in my perception, the issue seems to arise when they're being prescribed for like moderate pain issues and indefinitely. You know what I mean? I'm totally not against someone with cancer pain or other pain that's extremely intense, taking opiates. Like I would never, have an issue with that at all. It's just, more specifically, my whole thing is like things that could be actually treated and you could actually look at the underlying issue. I think when they're covered up with opiates, then that's kind of an injustice, if you know what I mean, you know?
And you touched upon it earlier. It actually has been shown to make pain worse. So it's not effective treatment.
Yeah, I mean, like I said, I'm not going to sit here and be like, hey, you have cancer,
And I really see like going through recovery as really
you can't do this. I,
right,
you
right,
know,
right.
that's not my thing at all. It's just, I do think that there's a lot of dogma, and so that's kind of why I'll be completely real and honest with you. That's why I kind of focus on this stuff sometimes, is because I feel defensive of people in recovery, because I'm like, I don't like the demonization of opiate addicts because it's just like, dude, like both people are the people who are, chronic pain patients and people who abuse them as chronic pain patients are both suffering. You know what I mean? And so I don't want to hate on anyone that's suffering basically. But like I said, I get defensive of the whole, oh, the drug addicts ruined opiates for everyone. You know what I mean? I feel that there's a lot more to it than that,
Oh, okay.
you know?
I hadn't really thought of it that way. So you do perceive or you hear a lot of that in kind of the
Yeah.
addiction arena.
Yeah, so
Oh,
it's basically chronic pain patients versus addicts that were addicted to opiates or even benzos. So the narrative is you guys ruined it from the patients, or like you ruined it for us normal people. And it's just that's where I get a little bit like, hey there.
well, and then that implies that people are choosing to be addicted. I mean,
Yes,
that's really the
exactly.
underlying. Yeah, okay.
Exactly.
Yeah, and that's a misconception. And so I really appreciate that you're putting that out there because that's not accurate.
Yeah, I mean, I take it, I will, like, I'll be completely honest. That's the one thing that I hear, and I'm like, get a little bit defensive, and I'm like, hey there, don't say that. Like, it's way
Um,
deeper than that, and we don't need to pit ourselves against each other. If you're suffering, then I love you, I support you, and I want the best, so. But
and
yeah,
that
thank you for letting me bring that up. It's something that that I always talk about, and it's valuable to hear, someone like a professional like you, opinion on it.
Well, and it's important that we have more and more informed prescribers because we're often the gatekeepers for this sort of thing too. So, and then also the exploration of alternative ways to treat pain. I mean, that's pretty cool to see recently too. There have been a lot of advances in that area. You mentioned CBD, that's one. Low dose naltrexone is another. I mean, there are a lot of cool things that are happening. So I encourage people, if they are experiencing chronic pain, to explore those different avenues and see what's out there.
Awesome. Yeah.
Yeah.
I mean, I didn't even really know about a lot of that stuff when I was like really deep into, my chronic pain. And I'll say this too, this is a whole nother thing. So a huge part of my recovery as well was chiropractic work, which a lot of
Yeah.
people have mixed feelings about. A lot of people think that it's like not real or whatever. There's like, I started going to a chiropractor when I came back to Austin from Mississippi, and it changed my life to where when I went into a chronic pain flare up, I can go to the chiropractor and I do get relief usually within one treatment. And so
Hmm.
for me, that's beautiful. Like you said, CBD is great. Excuse me. CBN is something that's not talked about that is legal in all 50 states. That is also really promising. I don't know if you've ever heard about it. It's very
Mm-mm.
interesting to look into. Basically, it acts as an analgesic, but it's like, it's a
CBN?
specific, yeah, CBN. So it's a
Okay.
specific isolated cannabinoid, but there's no risk of like overdose or like anything like that. And uh, I think it should be, I'm not a scientist or anything, but I think that it seems promising in treating opiate withdrawal potentially, even as a maintenance drug, like as an alternative to methadone or Suboxone. Like I
Hmm.
said, I'm not claiming to, like that's just from the little bit of research that I've done. And it's not talked about very often. And I think that, just, from what I've looked into, it seems very, very interesting. But what I'm getting at is that, in recovery, I was given the opportunity to address these things in a way that, didn't cause me any harm, because for me, it's just everything I was doing to treat, anxiety, pain, or whatever. It was just actually perpetuating my issues. And so, yeah, chiropractic work saves me. Like I've had in the past year, I've had a flare up to where I couldn't stand up straight and I had to like bend over because it was just so bad because I have something called spondylolisthesis.
Hmm.
And I went to the chiropractor and I left and I could stand up straight.
Yeah.
So
I'm a
yeah.
big believer in body work, and that's part of our training too, is massage and hydrotherapy and chiropractic type of adjustments. So definitely a big believer. And for people, if something doesn't work for them, like try something else. Like definitely check out different things and see really where you're getting the most benefits from, and don't give up. I think that's another important piece too.
Yes.
We probably should wrap up. Is there anything else? I mean, as far as how can people follow you? Like, what are the best ways to get in touch?
Yeah, well, I respond to DMs on here because I have a lot to say and it's hard to type all of it out. And so I do voice messages
Mm.
on Instagram. So if anyone reaches out to me, I will send a detailed voice message because it's just like I said, I have a lot to say about it. But I'm a TikToker. I'm on TikTok. That's like my favorite app at this point. And so I post content on there every single day. All my handles are sex and sobriety, on YouTube, TikTok, Instagram. And yeah, I even have a Patreon as well for people who want like curated recovery content, like, kind of tailored to their specific needs. So yeah, that's where all my stuff is at this point.
Well, thank you again for the work that you do, and again bringing that authentic piece, and just your enthusiasm really comes through, and you continue to inspire so many people. So, and I think TikTok is a great way to have a broader reach and to find those people who really need that kind of help.
Thank you. And I feel the same way about you. I remember when I first heard you talking on Clubhouse, I was like, okay, yeah. Your voice is very soothing. Like I said before, your energy comes through even just through your voice. And it's just, I love that, we have people like you that are, advocating for recovery and are doing it in a very mindful way. It means a lot. It means a lot to me. So I really appreciate you. And I'd love to collaborate with you more, specifically on TikTok when I can go live again.